So far, Nigeria has built about 30,000 primary health centers, or PHCs, across the country, and yet the government is lagging seriously behind in the delivery of quality health services. In 2018, the World Health Organization ranked Nigeria's healthcare system at 187th out of 190, with conflict-ridden countries like Afghanistan, Somalia, outperforming Nigeria on the index. The deplorable state of the PHC system has taken a toll on the public health situation in Nigeria. A recent report showed that 1 in 13 women in Nigeria is likely to die during childbirth. The same report found out that about 58,000 women had died from childbirth complications in 2015 alone, accounting for about 19% global maternal deaths in the same year. One can point to different reasons for the dire situation of PHCs in Nigeria, ranging from fragmented services to lack of qualified medical personnel to poor infrastructures. However, amidst all this, a fundamental issue facing PHCs is the lack of access to reliable electricity. Electricity is very important to PHCs for providing water supply, temperature control for medicine or vaccine storage, basic lighting, ventilation, and clinical processes. However, Nigeria's erratic power supply has been the bane of primary health centers in Nigeria. In 2018, the Heinrich Ball Foundation sponsored a situation analysis study that was carried out among 60 PHCs in Abuja, Nigeria. The study found out that almost half of the surveyed PHCs could not operate beyond 5 p.m. due to unreliable access to constant electricity, meaning that they could not accept overnight admission and they certainly could not handle emergency cases at night. Meanwhile, the other half of the surveyed PHCs that could operate into the night often had to rely on alternative power source from petrol power generators and other makeshift energy from kerosene lamps, candles, and torchlight. One of the field monitors during the study reported meeting a midwife who had delivered a baby in the dark because the battery to the torchlight went dead in the middle of the delivery. The lack of electricity is coming at a high cost to PHC's operation and is also a major barrier to quality health services. Certain PHCs in Abuja were found to spend as much as 500,000 naira, that is $1,300 equivalent, annually on petrol power generators, which are often paid for out of the pocket of the medical personnel, and charges from health services that could have been offered for free. Meanwhile, PHCs that could not afford to run petrol power generators could not appropriately store vaccines, and they also lacked clean potable water. So far, we have highlighted the problems faced by PHCs because of little or no electricity. What is then the solution? Standalone solar power solutions have great potential to provide access to cost-effective and reliable electricity for PHCs, especially the ones that are situated in low-income areas and away from the national grid. A study done in India showed that a solar-powered health center treated 50% more patients, conducted 50% more safe deliveries, and operated round the clock. In Dakwa, Abuja, Nigeria, a solar-powered PHC is already operational, which has been responsible for providing round-the-clock health access for the semi-urban populations on the outskirts of Abuja. The solar PV system has been running since 2016, thereby increasing the patronage from almost zero to about 100 patients a month. As a 2018 study has shown, there is an economic argument for installing solar-powered solutions in at least some of the existing PHCs in Abuja, especially if you consider how much is being spent by PHCs for electricity supply. The study found out that PHCs are already spending between 23,500 naira to 48,000 naira a month, enough to cover the bill for just 4 hours of grid electricity plus an additional 6 hours of running generators daily. If you do the math, the bill adds up to about 500,000 naira, that is $1,400 annually for just about 10 hours of electricity every day. Not nearly enough to meet the minimum set standard of running a PHC, meaning that each PHC needs as much as 900,000 naira, that is $2,500 a year if they are to meet the standard of 24 hours access to electricity. This is almost 5 million naira, that is $14,000 within the space of 5 years for just one primary healthcare center. At this point, it is important to know that installing and maintaining solar solutions will cost a fraction of that amount over the same period of time. The cost of installing 3 kilowatt solar solutions for a PHC is about 2.5 million naira. From the get-go, it seems like an enormous amount, but when you consider paying almost 900,000 naira annually for grid electricity and maintaining a power generator, compare that to the almost zero annual cost of maintaining a solar system, you will begin to appreciate the economic advantage of solar-powered PHCs. However, it seems that the FCT administration is not aware of these arguments, but rather focuses on establishing new PHCs, usually driven by political motivation, instead of the actual needs of the communities. And this is the primary reason why about 80% of the health centers in the country are not fully functional, because a lot of these so-called PHC buildings do not have equipment and staff. Between 2014 and 2015, over 91 contracts to the tune of 2 billion naira or $6 million equivalent have been awarded to build new PHC buildings, and according to these reports, dozens of these buildings have remained unused. This 2 billion naira could have easily been spent on providing standalone solar systems to about 1,000 PHCs across the country in 1 year. Funding. A key factor to consider in providing solar solutions for PHCs has generally been inadequate in the Nigerian health system, and the FCT makes no difference here. The percentage of the budget allocated to health has been dropping consistently for the last 3 years, from 4.23% in 2016 to 3.95% in 2018. Further analysis of the budgetary allocation to Abuja PHCs reveal that only about 66,000 naira, that is $180 equivalent, annually is made available to cover the cost of electric bills and maintaining power generators for each health center. A far cry from the 576,000 naira or $1,600 equivalent incurred by some PHCs. However, to solve this funding issue, increasing the budgetary allocation for primary health care by the Federal Ministry of Health is the obvious thing to do, but the Primary Healthcare Development Board in Abuja, FCT, needs to start giving special financial consideration to providing solar-powered solutions, especially during the construction stage of the PHCs, of which have been costed between 10 million naira to 40 million naira in the national fiscal budget. Ultimately, the Federal Ministry of Health should make it mandatory for PHCs to have solar-powered solutions as a minimum standard, thereby obligating the Primary Healthcare Development Board to provide solar systems for PHCs. Investment into solar is a no-brainer because at some point, the cost of solar energy becomes neutral. This is when the avoided cost of buying petrol and paying for grid electricity becomes equal to the cost of the solar investment. After that point, electricity is for free forever. The problems facing the primary healthcare system in Nigeria may be complex and would require a concerted effort to solve them, which could span over a long period of time. But something could be done right now to ameliorate the problem in the short term, and this is simply improving access to electricity for PHCs through solar energy. This action would definitely improve the quality of healthcare in the FCT and across Nigeria. This could save the 58,000 women that die yearly from childbirth, as well as the 2,300 kids under 5 years that die every single day.